Looking at the problem right away, you see terms like elevation, resolution, slice thickness, and skinning. This question asks you to choose the option related to the problems that can occur when this part is not good. The correct answer would be option D. If these aspects such as resolution are not good, it can cause problems in distinguishing small cystic structures. Generally, when the image quality is good, or when the slice thickness and image quality are good, the inside can be clearly distinguished as anechoic. On the other hand, if there is a problem in this area, you may see hazy whitish parts above the anechoic area which can obscure this part. Therefore, I can explain that expressions such as having significant difficulty in accurately distinguishing between very small cysts are most closely related to this particular clinical situation. Next, let's move on and look at question number 192. Looking at the question, it is asking which of the items listed in the options, when increased, improves axial resolution. Yes, since it's simple, let's go ahead and find the correct answer right away. The correct answer is C, frequency. When the frequency increases, the wavelength becomes shorter, SPL shortens, and axial resolution improves. You should consider this part as something that needs to be memorized perfectly. Next, let's look at question number 193 below. This question contains content that isn't very important, so you can just take it as a reference. This question is asking which type of resolution is measured best when using an ultrasound scanner. If a question like this asks about the resolution of an ultrasound scanner, you should choose axial, which is option B. It's not very plausible or likely to appear on the test, so just keep in mind that such a question exists as a reference. Let's take a look at question number 194 right below. This question is asking which type of probe among the options can generate a side lobe. The most important point is that side lobes can occur in all types of probes. There is also a similar concept called the grating lobe. In the case of grating lobes, you should know that this artifact occurs only in array-type probes. Since the question asks about probes that can generate side lobes, the answer is that it occurs in all types of probes. So you should choose all of the above. Next, let's move on and look at question number 195. Since the question is a bit long, let's start by interpreting it. An ultrasound examination is being performed, specifically an abdominal ultrasound, and the clue is that the patient is an average-sized 8-year-old child. Basically, you should imagine a very small-framed young child. The second clue is that a 3.5 MHz convex probe was used. Among convex probes, this one falls into the category of lower frequencies. This is a low frequency that can generally be used for adult male patients with a larger build. Looking at the next sentence, it asks what kind of result will occur when these two factors are combined. Since the size is not very large, applying a higher frequency would be necessary to obtain better images. If you apply a low frequency in this way, you may end up with images that have reduced spatial resolution. Therefore, when performing an examination, it is most important to select the appropriate probe according to the patient's body type or condition. Since questions about selecting probes in this way are always included on the test, make sure to use the clues provided in the questions to find the correct answer. Next, let's move on and look at question number 196. If you look at the question, it asks which probe should be used when performing a small part examination. Generally, when conducting a small part examination, a linear array method is used, so the correct answer is choice B. Just pair up the two keywords and you'll be able to answer. Alright, let's look at question number 197 right below. This one is also about selecting the appropriate probe. To create a cardiac ultrasound image, the phase array method listed as option C is suitable, and you should remember this through this question. Next, let's look at question number 198 below. If you look at the question, it asks you to select the item that cannot be measured using a tissue equivalent phantom. First of all, you need to remember this content itself. With a tissue equivalent phantom, you can measure axial, lateral, contrast, and slice, but you cannot measure temporal resolution. Please note this through the question. More detailed information will be explained later in the quality control section. Up to question 198, we have solved a series of problems related to the probe. Starting from question 199, we will move on to the next section and continue solving problems. The problems we will solve from here are related to ultrasound devices. In the previous section, we covered the basic principles, and in the second section, we solved problems related to the probe. Here, you can consider this as the section directly dealing with the control of ultrasound equipment. If you look at question 199, it asks which control amplifies the signal received by the receiver. The important thing is that it's not about transmitting the pulse, but rather, once the signal has already been received by the receiver, amplifying it is done with the gain control, which is option A. Since the gain amplifies the signal that has already been received in this way, remember that increasing the gain does not affect things like exposure levels. Next, let's move on and look at question 200. Unlike the receiver functions we just reviewed, this part is related to output power control. Unlike the receiver, this refers to the energy given when the initial ultrasound beam is emitted. You can think of it this way. As the power control here increases, the amount of exposure given to the patient also increases. The control part here, which manages power control, can be considered as the pulse. So it would be good to remember these two concepts together as a pair. The important point is to clearly understand through the concept of the device what the differences are between number 199 and 200. I want to emphasize this.